Hello, this is Holly Scrivener. I'm doing a presentation on otitis externa for Nursing 5372 as part of the University of Texas graduate program. Otitis externa is also called swimmer's ear. It's more common in the spring and summer months when people are in lakes and pools. It is an infection in the outer ear canal, often resulting from moisture getting caught in the outer ear canal. Infection can result and bacteria will grow. Signs and symptoms of otitis externa is pain in the ear, redness and swelling on the outer ear canal, itching, and drainage. Risk for otitis externa are moisture trapped in the ear canal, scratching the ear canal with a foreign object, swimming, hot humid weather, an increase in earwax, allergic skin disorders, and medical conditions that make getting infections easier. Otitis externa is a superficial infection that can result from obstruction in the ear canal, from narrowing of the canal, or buildup of wax. This buildup of wax allows water or moisture to get trapped, causing an infection. You can also have it from the absence of wax, from excessive cleaning, or frequent prolonged water exposure. Trauma and alteration of the pH in the ear canal or other causes. Pathogens causing otitis externa. The most common pathogens for bacterial infections are Pseudomonas and Staphylococcus aureus. Fungal infections can occur in a more tropical area or in patients previously treated with antibiotics. Common topical medications for treatment include acetic acid, Ciprodex, hypercortisone with acetic acid, neomycin, polymycin with a hydrocortisone solution, and cephalexin. Side effects of topical treatment include irritation and pain at the site, itchiness, rash, and dizziness or vertigo. Treatment with oral medication should only be used when the infection has spread beyond the ear canal for the immunocompromised or people with uncontrolled diabetes. Oral antibiotics are often prescribed in these events: neomycin, polymycin, or Ciprodex. Treatment with oral medications includes analgesics such as Tylenol, nonsteroidal anti-inflammatories such as Aleve or ibuprofen, and opioids for severe pain. Side effects of treatment with oral medications may include stomach nausea, upset, vomiting, diarrhea, or abdominal cramping, risk of hypersensitivity, and risk of allergic reactions. Another treatment that may be used is ear wicking. It's used in severe and or chronic cases. An ear wick is a small tube that is inserted into the ear canal to administer medications or drain fluids. This can get past narrowing or wax buildup. Prevention of otitis externa includes drying your ears completely after showering or swimming. You can use preventative drops after swimming or having ears immersed in water for long periods of time. Do not use cotton balls or swabs or foreign objects in your ears, and make sure you clean any extra wax on the outside of the ear canal. Effectiveness of treatment can be monitored at recurrent health visits. Prevention is mainly geared toward education in the form of pamphlets or posters geared towards prevention, education during health visits for adults and parents, and also you can utilize these tools at health fairs or in public pools. Okay, we are to the eardrop administration demonstration point in our video. So the first thing you want to make sure you always do is wash your hands really good with water and soap. Let them dry. Explain the procedure to your patient or your child. You want to get the drops, open them up, kind of put them in your hand for a little bit to mix it up and to warm it up. A cold drop will cause dizziness, so you want to make sure that you don't do that. Go ahead and remove the top. Being careful not to touch the tip. To administer to a child under the age of 3 years old, you're going to pull downward on the earlobe prior to putting the drops in. But for an adult 3 years and up, you're going to pull up and back. You want to place your drops without touching the inner ear and just drop the required number of drops. 1, 2, or 3. Ask the child to remain in place for 2 or 3 minutes, or the adult to remain in place for 2 or 3 minutes to let the drops stay in place. Make sure You store your drops in a dry, secured place according to the directions in the package. Make sure you get rid of any extra drops you have when you're done. You don't want to keep them and reuse them. When you're done administering the drops, let them lay there for 2 or 3 minutes, and then they can set up. Take a cotton ball or a tissue to wipe the part that's running back out of the ear. Wash your hands, have the patient wash their hands, and you're done.